Here are some risk factors known to increase the risk of developing pancreatic cancer. Tobacco. Smoking is one of the most significant risk factors for pancreatic cancer. People who smoke are about twice as likely to develop pancreatic cancer compared to non-smokers. Approximately 25% of pancreatic cancers are attributed to cigarette smoking. However, the risk starts to decline once a person quits smoking one. Being overweight, obesity is another risk factor. Obese individuals with a BMI of 30 or more have about a 20% higher likelihood of developing pancreatic cancer. Gaining weight as an adult can also contribute to this risk. Diabetes. Pancreatic cancer is more common in people with type 2 diabetes. The exact reason for this association is not fully understood, but most of the risk is observed in individuals with type 2 diabetes. This type of diabetes is increasing in children and adolescents due to rising obesity rates in these age groups. It's also linked to being overweight or obese. The risk for people with type 1 juvenile diabetes is less clear. Chronic pancreatitis. Long-term inflammation of the pancreas. Chronic pancreatitis is associated with an increased risk of pancreatic cancer. Chronic pancreatitis often occurs in heavy alcohol users and smokers. Workplace exposure to certain chemicals. Heavy exposure to specific chemicals used in the dry cleaning and metalworking industries may raise the risk of pancreatic cancer. Remember that some risk factors cannot be changed, such as age and sex. For instance, age. The risk of developing pancreatic cancer increases with age. Almost all patients diagnosed with pancreatic cancer are older than 45, and about 2/3 are at least 65 years old. The average age at diagnosis is 701. Sex. Men are slightly more likely to develop pancreatic cancer than women, partly due to higher tobacco use in men. Race. African Americans have a slightly higher risk of developing pancreatic cancer than whites. Pancreatic cancer is stages based on the AGCTNM system, which considers 3 key pieces of information. Tumor extent. TO. No evidence of primary tumor. TI's carcinoma in situ. The cancer is confined to the lining of the pancreas. T1. Tumor is 2 centimeters or smaller and limited to the pancreas. T2. Tumor is larger than 2 centimeters or has grown outside the pancreas into nearby blood vessels. Spread to nearby lymph nodes. NO. No spread to nearby lymph nodes. N1. Cancer has spread to nearby lymph nodes. Metastasis to distant sites. MO. No distant spread. M1. Cancer has spread to distant lymph nodes or organs like the liver, peritoneum, lungs, or bones. The stages range from 0 carcinoma in situ. TOIV. Stage O carcinoma in situ. Cancer is confined to the lining of the pancreas. Stage I. Tumor is limited to the pancreas. T1 or T2. Stage 2. Cancer has spread to nearby lymph nodes or nearby organs. Stage 3. Cancer has grown beyond the pancreas and involves major blood vessels. Stage 4. Cancer has spread to distant organs.